Which client is at risk for the development of a potassium level of 5.5 MEQL, 5.5 mmol, L? 1. The client with colitis. 2. The client with Cushing's syndrome. 3. The client who has been overusing laxatives. 4. The client who has sustained a traumatic burn. Answer: 4. The client who has sustained a traumatic burn. Rationale: the normal potassium level is 3.5 to 5.0 MEQL, 3.5 to 5.0 mmol, L. A serum potassium level higher than 5.0 MEQL, 5.0 mmol, L, indicates hyperkalemia. Clients who experience cellular shifting of potassium in the early stages of massive cell destruction, such as with trauma, burns, sepsis, or metabolic or respiratory acidosis, are at risk for hyperkalemia. The client with Cushing's syndrome or colitis and the client who has been overusing laxatives are at risk for hypokalemia. The nurse in the ambulatory care department hears a client in the waiting room call out, "Help! Fire!" The nurse rushes to the waiting room and finds the wastebasket on fire. Which action should the nurse take first? 1. Extinguish the fire. 2. Activate the fire alarm. 3. Confine the fire and then call 911. 4. Remove the client from the waiting room. Answer: 4. Remove the client from the waiting room. Rationale: the order of priority in the event of a fire is to rescue the clients in immediate danger. The next step is to activate the fire alarm. The fire is then confined by closing all doors, and last the fire is extinguished. The nurse is teaching a client with acquired immunodeficiency syndrome, AIDS, how to avoid food-borne illnesses. The nurse should instruct the client that which food can cause a food-borne illness. 1. Raw oysters. 2. Bottled water. 3. Pasteurized milk. 4. Products with sorbitol. Answer: 1. Raw oysters. Rationale: the client is taught to avoid raw or undercooked seafood, meat, poultry, and eggs. The client also should avoid unpasteurized milk and dairy products. Fruits that the client peels are safe, as are bottled beverages. The client may be taught to avoid sorbitol, but this is to diminish diarrhea and has nothing to do with food-borne infections. The nurse is assessing the intravenous IV line of a client who is receiving a chemotherapy infusion. The assessment reveals coolness and swelling around the IV insertion site. What should the nurse do next? 1. Stop the IV infusion. 2. Obtain a prescription for a chest X-ray. 3. Notify the primary healthcare provider. 4. Apply cold compresses to the insertion site. Answer: 1. Stop the IV infusion. Rationale: the assessment indicates that infiltration of the IV solution has occurred, and the infusion must be stopped immediately to prevent further infiltration of the chemotherapy fluid. The nurse next notifies the primary healthcare provider (PHCP) of the occurrence. The PHCP needs to prescribe the treatment for the insertion site. There is no useful reason for doing a chest X-ray. A client with urolithiasis is scheduled for extracorporeal shockwave lithotripsy. The nurse should tell the client that which will be necessary before the procedure is performed. 1. Insertion of a Foley catheter. 2. Assign informed consent form. 3. Clear liquids only on the day of the procedure. 4. Administration of antihypertensive medication. Answer: 2. Assign informed consent form. Rationale: extracorporeal shockwave lithotripsy is done with the client under epidural or general anesthesia. The client must sign a consent form for the procedure and must have no oral intake beginning the night before the procedure. The client needs an intravenous line for the procedure as well. Insertion of a Foley catheter is not normally performed, and there is no reason to administer antihypertensive medication for this procedure. The nursing student develops a plan of care for a client with paraplegia who is at risk for injury related to spasticity of the leg muscles. On reviewing the plan, the co-assigned licensed nurse identifies which action as an incorrect intervention. 1. Using prescribed muscle relaxants as needed. 2. Using padded restraints to immobilize the limb. 3. Performing range of motion exercises to the affected limbs. 4. Removing potentially harmful objects near the spastic limbs. Answer 2. Using padded restraints to immobilize the limb. Rationale: use of limb restraints will not alleviate spasticity and could harm the client. Use of muscle relaxants is indicated if the spasms cause discomfort to the client or pose a risk to the client's safety. Range of motion exercises are beneficial in stretching muscles, which may diminish spasticity. Removing potentially harmful objects is a good safety measure. A client is to undergo weekly intravesical chemotherapy for bladder cancer for the next 8 weeks. What instruction should the nurse provide to the client regarding management of the urine as a biohazard? 1. Void into a bedpan and then empty the urine into the toilet. 2. Disinfect the toilet with bleach after voiding for 6 hours after a treatment. 3. Purchase extra bottles of scented disinfectant for daily bathroom cleansing. 4. Have one bathroom strictly set aside for the client's use for the next 2 months. Answer 2. Disinfect the toilet with bleach after voiding for 6 hours after a treatment. Rationale: after intravesical chemotherapy, the client treats the urine as a biohazard. This involves disinfecting the urine and the toilet with household bleach for 6 hours after the treatment. Using a bedpan for voiding is of no value in this situation. Scented disinfectants are of no particular use. The client does not need to have a separate bathroom for personal use. A patient with leukemia is receiving chemotherapy that is known to depress bone marrow. A CBC, complete blood count, reveals a platelet count of 25,000 microliter. Which of the following actions related specifically to the platelet count should be included on the nursing care plan? A. Monitor for fever every 4 hours. B. Require visitors to wear respiratory masks and protective clothing. C. Consider transfusion of packed red blood cells. D. Check for signs of bleeding, including examination of urine and stool for blood. Answer D. Check for signs of bleeding, including examination of urine and stool for blood. Rationale: a platelet count of 25,000 microliter is severely thrombocytopenic and should prompt the initiation of bleeding precautions, including monitoring urine and stool for evidence if bleeding. Monitoring for fever and requiring protective clothing are indicated to prevent infection if white blood cells are decreased. Transfusion of red cells is indicated for severe anemia. The nurse is monitoring a client who is receiving a blood transfusion. After 30 minutes of the infusion, the client begins to have chills and back pain. His temperature is 100.1 F, 37.8 C. What action should the nurse take first? 1. Assess the client for other symptoms. 2. Slow the blood transfusion and monitor the client's vital signs. 3. Remind the client that these are expected reactions to a blood transfusion. 4. Discontinue the infusion and start an infusion of normal saline using new tubing. Answer 4. Discontinue the infusion and start an infusion of normal saline using new tubing. Rationale. Signs of a transfusion reaction include fever, chills, tachycardia, tachypnea, dyspnea, hives or skin rash, flushing, backache, and decreased blood pressure. If the client shows any symptoms of a blood transfusion reaction, the nurse needs to discontinue the infusion immediately and start an infusion of normal saline using new tubing connected to the hub of the intravenous insertion site. The nurse should stay with the client and monitor his or her condition while asking a colleague to notify the primary healthcare provider immediately. A client returns to the nursing unit after undergoing an esophagogastroduodenoscopy (EGD). Which is the appropriate nursing intervention? 1. Allow the client to have bathroom privileges. 2. Keep the client lying flat in bed in the supine position. 3. Withhold oral fluids until the client's gag reflex has returned. 4. Tell the client to report a sore throat immediately because it is a serious complication. Answer 3. Withhold oral fluids until the client's gag reflex has returned. Rationale. In preparation for the passage of the endoscope, an anesthetic is sprayed to inactivate the gag reflex and thus facilitate passage of the tube. It may take 1 to 2 hours for the anesthetic spray to wear off and for the gag reflex to return. The client should remain on bed rest in a semi-Fowler's position until fully alert. A sore throat is expected because of the endoscopic tube. An adolescent is admitted to the hospital after an accidental self-inflicted gunshot wound to the foot. The nurse should plan to take which action as a first step for the prevention of future injury? 1. Explore the client's knowledge of gun safety. 2. Assess the client for a history of risk-taking behaviors. 3. Refer the client to a firearm safety class sponsored by the hospital. 4. Have the client watch a video on the tragedies of improper firearm use. Answer 1. Explore the client's knowledge of gun safety. Rationale. A leading cause of accidental death in the adolescent population is improper use of firearms. Before implementing firearm safety goals, the nurse needs to obtain baseline data through a firearm safety history, which is described in the correct option. Option the second of may be indicated because of the relationships among accidents, impulsivity, and risk-taking behaviors. But assessing past risk-taking behaviors would not be the first step directed at prevention. Option the third of may be effective, but referral to a firearm safety course would not come before assessing the client's knowledge of gun safety. Option the fourth of may or may not be effective at some point for this client. The nurse has given a client with a leg cast instructions on cast care at home. The nurse determines that the client needs further instruction if the client makes which statement? 1. I should avoid walking on wet, slippery floors. 2. I'm not supposed to scratch the skin underneath the cast. 3. It's okay to wipe dirt off the top of the cast with a damp cloth. 4. If the cast gets wet, I can dry it with a hairdryer turned to the warmest setting. Answer 4. If the cast gets wet, I can dry it with a hairdryer turned to the warmest setting. Rationale. Client instructions should include avoiding walking on wet, slippery floors to prevent falls. The client should never scratch under a cast because of the risk of skin breakdown and ulcer formation. Surface soil on a cast can be removed with a damp cloth. If the cast gets wet, it can be dried with a hairdryer set to a cool setting to prevent skin breakdown. If the skin under the cast itches, cool air from a hairdryer may be used to relieve it. The nurse working in a correctional facility is caring for a new prisoner. The client asks about health risks associated with living in a prison. How should the nurse respond? 1. Healthcare is very limited in the prison setting. 2. Living in a prison isn't different than living at home. 3. Living in a prison can predispose a person to different health conditions. 4. Living in a prison is similar to living in a condominium complex or dormitory. Answer 3. Living in a prison can predispose a person to different health conditions. Rationale: the environment of a prison can predispose a person to different health conditions, such as tuberculosis, human immunodeficiency syndrome, sexually transmitted infections, or other infectious diseases. Option 1 does not address the client's question. Options 2 and 4 convey incorrect information. The nurse has observed that an older client has episodes of extreme agitation. Which measure is most appropriate for the nurse to implement to avoid episodes of agitation? 1. Wait until the client's agitation has subsided before approaching the client. 2. Speak and move slowly toward the client while assessing the client's needs. 3. Speak to the client at the entrance of the room to avoid any episodes of agitation. 4. Walk up behind the client and gently put a hand on the client's shoulder while speaking. Answer 2. Speak and move slowly toward the client while assessing the client's needs. Rationale: speaking and moving slowly toward the client will prevent the client from becoming further agitated. Any sudden moves or speaking too quickly may cause the client to become agitated and could trigger a violent episode. Remaining at the entrance of the room may make the client feel alienated. If the client's agitation is not addressed, it will only increase. Therefore, waiting for the agitation to subside is not an appropriate option. Walking up behind the client may cause the client to become startled and react violently. The nurse is completing medication reconciliation with a client just before discharge to home. The client asks, "Why are you going over this list?" "They did that when I was admitted." Which statement by the nurse is the best response? 1. Medication reconciliation is required before you can go home. 2. Your insurance company requires a list of medications that you will be taking. 3. We are checking to see what medications can be discontinued before you go home. 4. We do this to make sure you will be receiving the correct medications once you are at home. Answer 4. We do this to make sure you will be receiving the correct medications once you are at home. Rationale: although medication reconciliation is a required procedure by the Joint Commission, the purpose is to reduce the risk of medication error and to ensure that the client receives the correct medication at home. Explanation of the purpose is a better answer than simply explaining that it is a required procedure. The nurse is collecting a sputum specimen for culture and sensitivity testing from a client who has a productive cough. The nurse plans to implement which intervention to obtain the specimen? 1. Ask the client to obtain the specimen after breakfast. 2. Use a sterile plastic container for obtaining the specimen. 3. Provide tissues for expectoration and obtaining the specimen. 4. Ask the client to expectorate a small amount of sputum into the emesis basin. Answer 2. Use a sterile plastic container for obtaining the specimen. Rationale: sputum specimens for culture and sensitivity testing need to be obtained using sterile technique because the test is done to determine the presence of organisms. If the procedure for obtaining the specimen is not sterile, the specimen will be contaminated and the results of the test will be invalid. A first morning specimen is preferred because it contains overnight secretions from the tracheobronchial tree. The nurse is reviewing the client's laboratory report and notes that the total serum calcium level is 6.0 mg per deciliter, 1.66 mmol/L. The nurse understands that which condition most likely caused this serum calcium level. 1. Prolonged bed rest. 2. Renal insufficiency. 3. Hyperparathyroidism. 4. Excessive ingestion of vitamin D. Answer 1. Prolonged bed rest. Rationale. The normal serum calcium level is 9.0 to 10.5 milligrams per deciliter, 2.25 to 2.75 mmol/L. A client with a serum calcium level of 6.0 milligrams per deciliter, 1.66 mmol/L, is experiencing hypocalcemia. Prolonged bed rest is a cause of hypocalcemia. Although immobilization initially can cause hypercalcemia, the long-term effect of prolonged bed rest is hypocalcemia. End-stage renal disease rather than renal insufficiency is a cause of hypocalcemia. Hyperparathyroidism and excessive ingestion of vitamin D are causative factors associated with hypercalcemia. The long-term care nurse about to give a daily dose of digoxin is told that a serum digoxin level drawn earlier in the day measured 2.4 nanograms per milliliter, 2.7 nmol/L. Which action should the nurse take first? 1. Report the finding to the cardiologist. 2. Administer the daily dose of the medication. 3. Record the normal value on the InterShift report sheet. 4. Gather data from the client related to signs of toxicity. Answer 4. Gather data from the client related to signs of toxicity. Rationale. The normal therapeutic range for digoxin is 0.5 to 2.0 nanograms per milliliter, 0.6 to 2.4 nmol/L. A value of 2.4 nanograms per milliliter, 2.88 nmol/L, exceeds the therapeutic range and could be toxic to the client. The nurse should gather data about signs of digoxin toxicity first and then notify the cardiologist. Option 2 is incorrect because the next dose should not be administered automatically. Recording the value on the InterShift report sheet is incorrect because the value is high, not normal, and dismisses the subject at hand. The nurse is preparing to administer an intramuscular IM injection to a client receiving a continuous heparin infusion. Which action should the nurse prepare to do? 1. Use a 5/8" needle for the injection. 2. Apply prolonged pressure to the IM site after the injection. 3. Apply a 4x4 pressure dressing at the IM site after the injection. 4. Decrease the rate of the heparin infusion for 1 hour before and 1 hour after the injection. Answer 2. Apply prolonged pressure to the IM site after the injection. Rationale. Heparin is an anticoagulant that increases the risk of bleeding. Prolonged pressure over the site of an IM injection will lessen the chance of having an increase of bleeding into the tissue. It is not necessary to apply pressure dressing to the IM site of injection. A 5/8" needle is not an appropriate size needle for an IM injection. The heparin infusion is not decreased before an injection, and the rate is not adjusted unless specifically prescribed by a primary healthcare provider, PHCP. A client has had an invasive abdominal surgery to relieve an obstruction of the common bile duct. The client's surgery is completed, and the client has been transferred to the post-anesthesia care unit (PACU). The PACU nurse observes that the client suddenly appears red in the face and appears to be coughing despite the presence of an endotracheal tube and ventilator support. What action should the PACU nurse take first? 1. Suction the client through the endotracheal tube. 2. Instruct the client in the use of an incentive spirometer. 3. Turn the client from a 30-degree lateral position to a supine position. 4. Instruct the client to use a communication board to tell the nurse what is wrong. Answer 1. Suction the client through the endotracheal tube. Rationale. The client is choking on his secretions, which should be removed by suctioning the endotracheal tube. The client is unable to use an incentive spirometer while an endotracheal tube is in place. The client's inability to breathe impairs ability to learn how to use a communication board. Turning the client assists in clearing his airway, but a supine position will worsen the airway problem. Suctioning the client is the best nursing intervention because it will have the most immediate effect. The nurse is preparing to care for a client who has returned to the nursing unit following cardiac catheterization performed through the femoral vessel. The nurse checks the primary healthcare provider's PHCP's prescription and plans to allow which client position or activity following the procedure. 1. Bed rest in high Fowler's position. 2. Bed rest with bathroom privileges only. 3. Bed rest with head elevation at 60 degrees. 4. Bed rest with head elevation no greater than 30 degrees. Answer 4. Bed rest with head elevation no greater than 30 degrees. Rationale: after cardiac catheterization, the extremity into which the catheter was inserted is kept straight for 4 to 6 hours. The client is maintained on bed rest for 4 to 6 hours. Time for bed rest may vary depending on the PHCP's preference and on whether a vascular closure device was used. And the client may turn from side to side. The head is elevated no more than 30 degrees, although some PHCPs prefer a lower position or the flat position until hemostasis is adequately achieved. A clinic nurse is providing instructions to a female client regarding the procedure for collecting a midstream, clean-catched urine specimen. What should the nurse instruct the client to do? 1. Begin the flow of urine and then collect the specimen. 2. Cleanse the perineum from back to front before collecting the specimen. 3. Collect the specimen in the evening before going to bed, and deliver it to the laboratory immediately the next morning. 4. Scrub the perineum with povidone iodine solution in the evening and again in the morning before collecting the specimen. Answer 1. Begin the flow of urine and then collect the specimen. Rationale: the client should briefly delay collecting the sample until after starting the flow of urine. As part of the correct procedure, the client should cleanse the perineum from front to back with the antiseptic swabs that are packaged with the specimen kit to prevent contamination of the specimen. The specimen should be sent to the laboratory as soon as possible and not allowed to stand. Improper specimen handling can yield inaccurate test results. The client is not instructed to scrub the perineum with povidone iodine solution in the evening and again in the morning before collecting the specimen. This action is unnecessary and can cause irritation. The nurse is providing care to a Hispanic client who is terminally ill. Numerous family members are present most of the time, and many of the family members are very emotional. What is the appropriate action? 1. Restrict the number of family members visiting at one time. 2. Inform the family that emotional outbursts are to be avoided. 3. Contact the primary healthcare provider to speak to the family regarding their behavior. 4. Request permission to move the client to a private room and allow the family members to visit. Answer 4. Request permission to move the client to a private room and allow the family members to visit. Rationale: in Hispanic cultures, loud crying and other physical manifestations of grief are considered socially acceptable. Of the options provided, the correct choice is the only one that identifies a culturally sensitive approach on the part of the nurse. The remaining options are inappropriate nursing interventions. The nurse is caring for an abdominal surgical client who has a Jackson-Pratt drain in place. Which interventions should the nurse include in the plan of care for this drain? Select all that apply. 1. Secure the drain to the sheet. 2. Make sure suction is maintained. 3. Check that the drains are sutured in place. 4. Use clean technique to empty the reservoir. 5. Compress the reservoir to restore suction after emptying. 6. Record the amount and color of drainage according to agency protocol or surgeon's prescription. Answer 2. Make sure suction is maintained. 3. Check that the drains are sutured in place. 5. Compress the reservoir to restore suction after emptying. 6. Record the amount and color of drainage according to agency protocol or surgeon's prescription. Rationale interventions include making sure suction is maintained, checking that the drains are sutured in place, compressing the reservoir to restore suction after emptying, and recording the amount and color of drainage according to agency protocol or surgeon's prescription. The other interventions are not appropriate. The nurse is caring for a client with metabolic alkalosis. The nurse plans care knowing that most problems of metabolic alkalosis are related to increased stimulation of what systems? Select all that apply. 1. Buffer 2. Cardiac 3. Nervous 4. Chemical 5. Respiratory 6. Neuromuscular. Answer 2. Cardiac 3. Nervous 6. Neuromuscular. Rationale. Most problems of alkalosis are related to increased stimulation of the cardiac, nervous, and neuromuscular systems. Chemical reactions are also called buffer systems and are not related to most problems of alkalosis. The respiratory system is related to respiratory alkalosis and not metabolic alkalosis. The nurse manager is giving a staff in service on providing culturally sensitive education to clients. Which statements indicate to the nurse manager that the staff understands providing culturally sensitive education? Select all that apply. 1. Educational topics are always determined by the nurse. 2. All clients view education about their health status as important. 3. The population served will determine the culturally sensitive resources to use for teaching. 4. Assessment of a client's preferred learning approach is essential to facilitate the learning process. 5. It is important to have an accurate translator when the nurse and client do not speak the same language. Answer 3. The population served will determine the culturally sensitive resources to use for teaching. 4. Assessment of a client's preferred learning approach is essential to facilitate the learning process. 5. It is important to have an accurate translator when the nurse and client do not speak the same language. Rationale. Providing culturally competent care or education is an important aspect of nursing. Care or education must be emphatically based on the client's culture, otherwise, the care or education is not specific to the client. The correct options address culturally specific and individualized care. Options 1 and 2 are not individually focused. The nurse is assessing the extremities of a client who had wrist restraints applied 2 hours ago. Which findings noted by the nurse are indicative of impaired circulation? Select all that apply. 1. Areas of pallor 2. Areas of erythema 3. Decreased movement 4. Heightened sensation 5. Decreased temperature 6. Reports of pain or tingling. Answer 1. Areas of pallor 3. Decreased movement 5. Decreased temperature 6. Reports of pain or tingling. Rationale. When assessing the skin of a client with bandages, casts, restraints, or other restrictive devices, assessment findings indicating impaired circulation include the following: areas of pallor, decreased movement, decreased temperature, and reports of pain or tingling. Areas of erythema and heightened sensation are not appropriate findings. The nurse is admitting a client with hypoglycemia. Identify the signs and symptoms the nurse should expect. Select all that apply. A. Thirst. B. Palpitations. C. Diaphoresis. D. Slurred speech. E. Hyperventilation. Answer B. Palpitations. C. Diaphoresis. D. Slurred speech. Rational palpitations. An adrenergic symptom occurs. The glucose levels fall. The sympathetic nervous system is activated, and epinephrine and norepinephrine are secreted, causing the response. Diaphoresis is a sympathetic nervous system's response that occurs as epinephrine and norepinephrine are released. Slurred speech is a neuroglycopenic symptom. As the brain receives insufficient glucose, the activity of the CNS becomes depressed. The nurse is teaching a client with polycythemia vera about potential complications from this disease. Which manifestations would the nurse include in the client's teaching plan? Select all that apply. A. Hearing loss. B. Visual disturbance. C. Headache. D. Orthopnea. E. Gout. F. Weight loss. Answer B. Visual disturbance. C. Headache. E. Orthopnea. E. Gout. Rational polycythemia vera, a condition in which too many RBCs are produced in the blood serum, can lead to an increase in the hematocrit, hypervolemia, hyperviscosity, and hypertension. Subsequently, the client can experience dizziness, tinnitus, visual disturbances, headaches, or a feeling of fullness in the head. The client may also experience cardiovascular symptoms such as heart failure, shortness of breath, and orthopnea, and increased clotting time or symptoms of an increased uric acid level such as painful, swollen joints, usually the big toe. Hearing loss and weight loss are not manifestations associated with polycythemia vera. A patient is admitted to the hospital with suspected polycythemia vera. Which of the following symptoms is consistent with the diagnosis? Select all that apply. A. Weight loss. B. Increased clotting time. C. Hypertension. D. Headaches. Answer B. Increased clotting time. C. Hypertension. And D. Headaches. Rational polycythemia vera is a condition in which the bone marrow produces too many red blood cells. This causes an increase in hematocrit and viscosity of the blood. Patients can experience headaches, dizziness, and visual disturbances. Cardiovascular effects include increased blood pressure and delayed clotting time. Weight loss is not a manifestation of polycythemia vera.